Kylie Sheppard. My pronouns are she, her, and I'm a therapeutic radiographer currently working in the clinical trials radiotherapy team at the Cambridge Cancer Trials Centre at Cambridge University Hospital. I qualified in 1991, so I won't go through all my background because we'll be here rather a long time, but I've worked treating, planning and caring for patients with cancer in that time. What is radiotherapy? It is the use of high energy X-rays and other radiation particles to treat patients with cancer. And as therapeutic radiographers, we are the only registered profession that can deliver that treatment. My primary responsibility as a therapeutic clinical trials radiographer within the team is looking after the breast portfolio. I see myself as a constant. I work alongside all the other team members, but I am there to support patients from the very beginning of their trials process. I screen patients, identifying them as being potentially eligible for clinical trials. At that point, we will approach them, giving them as much information as we can, and I will see them alongside other clinicians, but also independently. I can receive their consent, and once they have decided to enter the trials, then they're stuck with me for the whole way. I see them at the beginning, I follow them up during their radiotherapy, and all the way until they finish, and for some of our trials that can be up to 10 years. One of the trials that I am involved with is called the SMALL trial, and that's looking at removing tiny indolent breast cancers with a radiological technique that allows patients to avoid having conventional lumpectomy. So they have no general anaesthetic, their time to recover is much less. They're in and out of the breast unit within just a couple of hours. We had one lady whose son was getting married, and she was so worried that she was either going to miss his wedding or just not be herself. And luckily, she was randomised into this radiological arm, so she was in and out in a couple of hours and was absolutely delighted and had a great time at her son's wedding. So I must say that one of the main challenges we face in our role is actually that people don't know who we are and what we can do. There's quite often set pathways that nurses, doctors, and even other well-known AHPs like physiotherapists follow, whereas for us, I do feel we're constantly having to remind people not just what we traditionally do, but what we can do and what we can offer. I must say that as a therapeutic radiographer, I find it a great privilege being there with people, especially during COVID when they had no family with them, actually being able to offer that support. And for some people, they even have described us as translators. To the cancer muggle, some of the terms we use are not well known, and just being there, you're not a doctor, but yet they know that you are instrumental in their treatment, and I feel that they find this very useful and find us approachable and knowledgeable. I collaborate as part of the breast multidisciplinary team alongside my surgical colleagues, my medical colleagues, nursing colleagues and other AHPs. We screen the patients coming onto the MDTs to see if they might be suitable for trials. We attend the MDTs to actually point this out, because my portfolio in breast radiotherapy is obviously a lot smaller than everybody else that's involved. So sometimes they may overlook them, and you're there to advocate for the patients and the trials that you're involved with. The thing I'd really like to highlight, not just to patients and the public, but to other healthcare professionals, is the versatility and the vast amount of experience as therapeutic radiographers we have to offer throughout the multidisciplinary team and the patient pathway.